Okay, this scar was revised.
Yeah, it was revised.
Okay.
This side.
Oh, this side is not looking very nice. Still healing and all of that.
Yeah.
Okay. Open your mouth. Bite. All right.
Yeah. So this one is the upper jaw advanced and the implants removed.
The one that we left behind last time.
Yeah.
Yeah.
There's this little thing here.
Correct. That notching.
Yeah.
But upper jaw advancement, why would you need?
I would, because that's the main thing I came in for.
Okay.
Even this, I don't know, I just was okay with it. But this, like, my mom really freaked out. It's like one surgery and so much change. You're looking sorted.
Huh.
So this thing is, because when I sing, I want to show. It's sort of receded, and that's why this is looking huge. See?
Okay.
And I smile, this stands out. So if this comes out, I'll like look leaner, I guess. And on camera, it's all about the camera thing.
Correct, but your upper jaw should not get worked upon again. I don't think it's a good idea.
Again?
The reason is because, see what happens if I move your upper jaw, I have to move your lower jaw also.
Yeah, I'm aware of that.
That's not worth it. I cannot move just your upper jaw.
Yeah,
That's why it's not a good.
changes.
Yeah, so I don't think that is required. Because if I move your lower jaw will come more forward. Then it will look really bad.
The implant removed.
Still-
And this angle, if possible.
This is easy to remove,
Yeah.
but there's no point removing it because the skin here will get loose. Now the skin is stretched and it looks nice.
Yeah.
If I move, I have to move from here to
Yeah.
lower jaw. If I move the lower jaw from behind,
Ah.
what will happen is your face will look overtly big and overtly protrusive, lower third. Already it looks good now. Actually, your lower third looks nice by itself.
Yeah.
I do agree your upper third can come forwards.
Yeah.
But we can't do it without touching the
Without
lower
touching
jaw.
the lower.
That's why we should not do the upper jaw.
Because that would aesthetically, on the camera it would look better.
No, I don't think so. Might look
when
worse.
I sing, then it will make it better. Because this was always my concern. We have an implant which is just popped out. There's a screw here. There's an implant here which is like with the screw. So it will more look bad.
That we can do, but the thing is, upper jaw advancement is not a good idea for you. Seriously, trust me, because if I do that, lower jaw has to be touched. Lower jaw, there are two issues for you. One, this area is looking nice now, and if I bring it forward, it's not going to look nice after that. It's going to look really bad. I can show you a morph thing or something, but it's not a good idea.
I can see the morph because when
I can do that.
When I do pouting, certainly it like
You don't mind it. You don't mind it coming up so much forward.
I don't mind because I'm fairly tall for. Like I'm not very tall, but I'm tall.
See,
my
that
face could do
your
with a
lower-
little length and with protrusion.
No, I personally don't think it's a great idea, but I
your
can
thing
show
is
you.
Your call is the final, but having said that, like I would want the upper jaw forward. So what best can we do is.
So, did we take a scan today?
We did. The last time scan had
But
shadows.
this is showing. This was taken today. Side. Smile. Okay, relax. Okay, smile. Yeah. If you don't mind your lower jaw, we call it anti-face.
Yeah.
Anti-face is like Angelina Jolie. Those kind of actresses, some of them really sport a
Yeah.
very long but you know, it's not a lot of Indians like it, and I personally have to warn you that you will get something like an anti-face. If upper jaw will look good,
Yeah.
definitely upper jaw will look nice, but now this part of yours is looking nice
If you
already.
head, like when this goes out and this comes out mildly or whatever degrees. So with the chin implant removed.
Then you'll have loose skin here. I
Oh.
can't do that. See, that's the catch, because once you stretch it,
But the implant is leaving a dent here.
that I can correct easily.
Yeah.
That small dent bent and all right, but if I remove it fully, then it's going to cause.
Maybe you could just trim them.
That's okay. That is
You
easy.
can.
I can. But if I remove it, then this area is going to get loose. Now this area is really nice, and this angle is also quite nice. You have. It's much improved than before.
Yeah, of course.
So all of that I can correct, but this will look good. Your
Yeah.
upper jaw for sure look good,
That is my main concern.
but the lower jaw
can look
not
long
good. It's going
or
to look
slight.
very protrusive than now, because your lower jaw looks good already. So that's the call that you got to take,
On my
because
face, would it look like very outlandish?
not very outlandish, but it will look
Because a
little bit more aggressive.
leaner aggressive.
like if it's lowered a little bit too strong.
The implant thing, if it's trimmed from the sides,
I can do
little
that.
pointy,
That I can
then
do.
I can live with that.
You don't mind if
I
it's
don't mind.
with a bi jaw.
Yes.
And one more thing, when you smile now, say smile, talk, your teeth are not so visible.
They are.
So do you want it more visible when I bring the
Yes,
upper jaw
please.
forward?
Absolutely. It goes slightly up and it comes out.
நான் பிஸியாக இருக்கேன், அப்புறம் கூப்பிடுறேன் பாலாஜி, பார்த்துட்டு இருக்கேன். So when would you want me to do all of this then?
If you're
No,
I
Baba.
go off to Muscat circuit running like.
No.
No.
I'm off to today.
Yeah. So this also my mom said like clearly tell him not
No.
anybody else.
No, but
Not Dr. Professional,
but
not
this we can't add with the jaw surgery now. If you want me to do the 2 jaw surgery, that itself is a big procedure. It'll take me 3-4 hours. I have to plan a lot. I can't do any soft tissue with that. If you want me to do the soft tissue, I won't be able to do all of this together in one go.
This marks are like really.
We'll have to do that on a separate call, or do that
It's
first.
two anesthesias though. That's
No,
the
this I
problem.
can do it in a local anesthesia. No need of general anesthesia.
Later?
Yeah, later. Or
And
now.
This thing, I'm watching. I just
Later.
thought like a bit of bit things.
Later.
Later.
All of that has to be
I
later.
thought like one surgery और पूरा हो जाएगा.
नहीं हो पाएगा, सॉरी जी, नहीं ये बाईमैक्स करना तो ये ऑलरेडी बहुत मेजर है आपके लिए.
Yeah. Your call is final. So I'm
So
just leaving
not
it
my
to you
no,
to
but
take a
no,
pic and
but
you
but
like
but
tell me.
listen, we have options now. You can get it done today
Yeah.
evening, because we
Yeah.
need some few hours to work you up.
Fine.
I'll be only able to do your jaw, nothing else.
Yeah.
And because I have to remove 4 screws, actually 6 screws, 2 screws here, 2 screws there, and then
those two.
and
Yeah.
those 2 screws,
Yes.
6 screws, and
They
the
want good show like the teeth.
and then the good advancement,
Yeah.
both the jaws, and that's it for now. We can't do more. Then we
These
wait.
things, and yeah, when you do that, you'll like make sure that it's not flaring.
It won't flare.
Fine, I'm sorted. Like your call is the final.
So we'll talk to them, and then रिजू से बात कराओ. रिजू से भेजो, फर्स्ट भेजो जल्दी से. When did you have your food last?
I just had a coffee. Last was yesterday 7 o'clock. I had a biryani.
So nothing in the morning? Okay, then let's quickly see.
Yeah.
Right. What's up? I know, but what is happening to the rhinoplasty guy?